in and the correlation test. Yeah? Correlation. Which one is, and only when
Goes
thumbs
up.
That is very good for you. No? You see the point again is ill. And what is Derivation? Do you know the meaning?
No.
That is for the liver, for the Ausleitung. No? And Derivation is for the liver.
Liver.
To detoxify.
Detoxify.
Environmental.
Environmental.
Toxins. And your burden is environmental.
Environmental.
No? It
Yeah.
fits.
Yes.
No? So you can, it's really. No?
Yep. Bicep.
For the lymph. That is for the liver again. No, this one not. Not.
Yes.
It's for the brain. That was with Emily, placenta,
yeah.
and there was a connection to the first tooth. Soligago, that is for the kidney.
Kidney.
That is immune system. And that's it.
This is thyroid.
Thyroid, yes.
But
with all-
hyperfunction.
Yes. But it is sometimes against Hashimoto and so on.
Hashimoto.
Because they are all components. No? Yes, and then you go on and it's your turn. Yes. Ah, wonderful.
Das sind jetzt alles Sachen, die ihr gut tun.
Die ihr gut tun. Medikament kann man auch so sagen. Yeah, and now we have here and now we have to quantify. To quantify, here's a honeycomb, und das müssen wir auch, then we will write down the amplification. Honeycomb 1. Yes.
Das heißt, der Substanztest ist jetzt aus, ne? Für die Korrelation.
And 1K. No, or 5K, it doesn't matter.
Also wie hoch ist die Belastung jetzt, ne?
Now it is arsenic, it is here.
Ja, in der Waage.
Ja.
Yeah,
in der
yeah, it
Waage.
is both. Yeah. Yes, and 10K. Well. Less, 8.
Okay.
Yes, write down heavy metals.
Heavy metal. AK.
Da kann man dann in Ruhe alles durchquantifizieren. Da kann man da reinsammeln. Ach, das ist gut.
More, 10. 10K. Yeah, yeah. It doesn't matter, yes, it's okay. More.
It's a colony.
Yes. 2. write down 200,
200K.
200,
200.000, ne?
200,000. Ne? More, 10K. More. One. Exact 10K. These are biocides or
Biocide.
Mhm. More, 10.
10K.
More. 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 2. That's it. No? That is here. Or that is oh.
Also,
Mm.
Chinese fruit.
No. The preservatives. Oh. Mhm.
This? No, it's also quantification.
Aha. Aha.
Okay.
Mm. More. More. Yes.
100?
No, it's okay. More. Less. Yes, and bacteria, 300,000. And that's it. And what do we do now?
Now, the plate, the first program is 99. And
Yes, but where is that is the end test.
Yeah.
And now you can do when you want. Here we go back here into the remove.
Oh, remove.
Yeah.
哎，全部把它 remove。
Yes, and now we want to know the highest burn. No? Because here, no? Because for example it is a Campylobacter, Helicobacter, and then it is a special issue, and well, FSME, ja, und wie staat hier? It is too much. You can forget it. Next. Next. Ah, yes, yes.
Machen wir die anderen gelb oder wie machen wir die anderen?
Ach, die kann man dann gelb machen, ja.
Damit man weiß, wo man...
Ja, ja, ne, Sie haben recht, ich jetzt im Moment gar nicht dran gelb. Yellow.
Oh, yellow. Weil das sind ja auch
Ja.
schwerwiegende Anliegen.
And now I have here 50,000. And then I push again. And then you have, when you print it, then there will be 50. Yes. Then you must at the end of the test, when you will, then you must push again, and then it is firm.
Yeah.
And here, Campylobacter, yes. MORA. MORA. Yes, or it doesn't matter, one on the left. And now you must push again for the
The
print.
print.
Yeah? Don't forget it. No? And now it is stored or saved. And yellow. Yes, you must do really. No? And no estradiol. No. And here only it is interesting when there is a D4. Und ist das alles schon ausgeschaltet? Das muss ich nochmal zeigen mit dem nochmal Mitochondropathia.
Hier auf dem
Transparency.
PowerPoint, ne?
So, and now we can go on with the therapy, but don't be astonished. Yeah?
Therapy.
Wenn die von da aus gucken.
And then we start.
But we don't want to all of this.
Yes.
那你全部要关
No,
掉，
no, no.
welche Farben?
一定有。
And now you see,
Das sind ja die.
We don't want to this go to the 99, right?
Das sind ja die
Need the empty of 对，把它拿掉。Therapy.
Im Prinzip waren auch die schlechten Sachen da drin.
Yes. Now it's gone.
no, why?
Das ist ein-
Because
I
this
closed
is close the channel 2.
Oh, I didn't understand it exactly. Back.
Back.
So if you
Yes.
turn it on,
Channel 2,
it was open, so I closed it, and then so it's gone.
yeah. We had here the channel,
Nothing. Now
that
it's
is
nothing.
one. And now there is nothing in it.
Now it's nothing.
Now it's nothing.
I
There
put
is
it back.
nothing. And now we can
Start therapy.
and go on.
Start.
Mhm.
Now it's no all of our tests.
Yes.
So this is right.
This is right.
When we run 99, just put on the back.
Yeah. And
And
drop
just-
of blood.
And the blood just for this one, right?
Yes.
And this is missing, right?
Yeah, that is
Okay.
bad. And yes, otherwise, really, I didn't know that with Channel 2. Really, thank you. Thank you very much.
Ach, das heißt, wenn Kanal 2 ist, ist es ausgeschaltet.
Ist es
sozusagen?
das alles haben wir Kanal 1 getestet.
Aha, und
Und
Kanal
wenn
2
wir
wäre
jetzt Kanal 2,
Abschaltung.
ist das praktisch alles abgeschaltet. Ne?
Aber man sieht nicht jetzt, was man in 99 im Programm hat.
So
Ne?
就
Nee, ist ja gar
里
nichts.
面
Das ist nur
所
die
有
Rückenelle.
所有这些都不放，
zur Aktivierung der
自己
Selbstheilungskräfte
的
sozusagen.
Blood
Ja, nee,
在这里。
die Wirbelsäule, das ist ja der Blasenmeridian.
So
Der
so
hat-
the blood 应该是放在这里，this one, because this is open, this is closed.
Oh, this is closed, yes.
Yeah.
Oh, that is,
Ah ja, okay.
that is really confusing. Ne? You must see it every
Every step.
You must,
Jeder findet was raus, ne? Irgendwie.
yeah, and that
Ah,
is
ja.
not okay. Ne?
Ja, da kann sie jetzt nicht,
Geht
weil
ja
die
nicht,
Therapie
nein, nein.
geht. Mhm.
No, it is too much.
Okay.
Ah.
Oh, 10, just 10. Right?
Yes.
Okay. Back, 你 back
Cancel, at first cancel.
cancel。它只能10倍，对，我记得。
Yes, that's it. And again.
Also auf 10.
Ja, 10-fach kann man auch wählen, aber nicht so hoch.
Das andere war
Dann kann das
Reden, ne?
kippen, ja.
Ah ja, dann gibt's ins Gehirn. Genau.
So you see this,
Yeah.
this is on. So
Yeah, yeah,
input
yeah, yeah.
need to
Ja, 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 ja. Mhm.
Also
because
Rücken, Elektrode und
I
Füße.
think this lines
Mhm.
on,
Ja, ja.
but this cross.
Yes.
So this need to here. Blood here.
Blood, ja.
Mhm.
Mhm. Yes.
Oder die Hose von Frau Hüller.
Mhm.
Die würde da auch
If
aufpassen.
want to come up something, this double.
Mhm. Mhm.
There, this is on here
Ja.
for drinking
Mhm.
water or
Yes,
or wine.
ja, 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 auch Wein.
Ja, da zeigt er dann an. Sozusagen wäre jetzt die Rückenelektrode und die Fußgeschichte an, ne?
Mhm. Mhm.
好了，我来做治疗。
Yes, we have to do this. But now I think no problem. This I didn't know. And here, and I must give attention to that, that's clear. And yes.
This is a parameter.
Yeah, yeah, yeah. Correlation test. Then we can stop.
Okay. Cancel.
Back.
And then 78.
Yes, look.
10, right?
Mhm.
Therapy. But no.
No.
No here. So
Aber
it's,
welche Wabe denn?
that is wrong.
Yeah.
Das ist
And the back. We need to open
Yeah.
this. Yes.
Yes, that's it.
And then therapy. And then stop.
Was waren das jetzt, die Organpräparate?
Ja,
Yes.
das war ja alles die Medikamente.
Die guten Sachen,
Die
die
guten
über
Sachen.
78,
Ja, ja.
Trockenspritze ist das ja.
Trockenspritze, ne?
Einmal.
We call it dry injection.
Dry injection.
And
So
because it's
just for 78 plus, but no need some of our test, the colon or something.
You
Coefficient.
can add, but for me, I prefer the special 78, and there is too much colon and so and selenium and so on. My experience is that it is better when you take the medication. We have a lot of experience with these, all these medications, and colon it is D4, and the normal potency of colon is D6, the old one. But now you have a negative information when you put in colon there, because it's D4. D4 is degenerative. And then, because it is a dry injection, you can promote the bad situation of the colon. You give him, that is a nosode colon. Now, it is too long to explain. But think all the preparations, they are in D4. D4 is degenerative, and you should not inject a degenerative nosode.
Okay.
And therefore, and it is really enough. And now the 70 we cancelled.
Also keine Nosoden in die 78. ne?
Ja.
Das
Ja,
war jetzt
es
die-
könnte hier
Nein,
von Colon
nicht,
auch
ja.
gut sein, aber ich
Stop.
bin da vorsichtig. A bit, only a bit. But therefore, to be certain about my therapy, I prefer this one.
Okay.
He can do that.
How about the deficiency, the selenium or zinc? Use
Yeah, you can do it. You can do it.
0.1.
No, I will not do this.
That
no.
is very
No.
small information.
And yeah, but
This is
I don't
right?
I don't see the advantage to
Yeah.
take the. You can do it. What is your experience? It depends. But for me,
But I am adult. This
yeah,
use-
yeah. I will not do it. We can do this here, yeah? And then you
应该
have.
至少要1倍，他用0.1就好奇
Die
怪。
packen alles rein, sozusagen.
Ja.
Und machen eine ganz geringe.
对啊，根本就是你把本来的 information 变成
Aber
10
Ja, da
one，
müssen
就是变成
die-
1/10嘛。
packen die auch nur. Ich hab's
Nein,
nicht-
nein, nein, nein.
das
Sie
nicht,
packen
ne?
nur
Okay，
hier,
Die guten Sachen rein.
ja, nicht die gut, aber
所以那他至少要用10倍啊。
und Dopamin oder
Sporen
Acetylcholin. Aber Dopamin man kann wieder geben. Acetylcholin kann man auch geben in 78 Acetylcholin. Dopamin 78, Melatonin, Progesterone
78.
and but medorinum no, and chakra no, and therefore it is you must have a broad knowledge
Yeah.
about every
Every
substance,
substance.
and therefore yes, and now we have the same problem as we had before. There's no deficiency and no, yeah.
So if use this in the 78, need the
Yeah.
at least
Yeah.
10, right?
Yes, and then you cannot do any harm with 10. With 100, it can be the controversy. Yeah?
Controversy 太大也不行。
Then it is too
And-
high.
And the too low is
Yeah,
not.
nothing. Eh?
Yeah.
Because when you choose this one,
Mhm.
all information
Yeah, this information.
are decreased.
Yeah.
There you see. And
Yeah.
only when you give them melatonin or dopamine, for
Yeah.
example, then only 10%
Yes.
of the dopamine
Yeah.
is
Nonsense.
acting.
Yeah.
Why? And he must have dopamine in full.
At least
Yes,
1
one.
or 10.
10, yes.
Yeah.
And
Makes sense.
yeah, makes sense.
Yeah.
The maximum is 10 or
Yes, it is. When we use 100, or even I did it with 1K, and then it is the opposite sometimes.
它就
That
会
is a
变成
burden. Ne?
变成
When you
反
have
向波。
when you have here a curve, and then
Too
with too much and 10 and 100, and it is not such, but then it will go in the opposite.
Opposite.
That is the danger. You can do it sometimes, but I will be sure what I'm telling. And here, dopamine is good. Melatonin, yeah, progesterone, yes, you can. But here, medorinum, no. But who knows? Who knows? And every
knows, yeah.
nosodofibromatosis never give them as a dry injection. That is cancer.
They usually try this to patient,
Mhm.
but they just use this and they say yes, this can. I just use this for 78.
That is not
Natural.
correct. That is not correct.
这我跟他们讲。
Everybody may have his
讲
own
整年都没有用，
his
他们
own
都这样
opinion.
做。
I get everybody may have his own opinion, but this is not correct.
This
That
not
is Mama D3. That is benign, or perhaps here even malignant tumor, and you cannot inject.
Yeah, yeah.
This is nonsense.
Nonsense.
Or it is dangerous.
Dangerous. Yeah.
And when you put this one,
Also dangerous, right?
yeah.
Yeah.
And then when you give dopamine only 10% here,
Yeah.
you can forget it.
Yeah.
And nevertheless, selenium and so on, or dopamine. Therefore, I stopped. I was the first therapist who recommended to give all here, but now we don't do it because you can, when there is a lack of selenium, you cannot transfer it. You must take it.
Take it.
Take it substantial, not as only as information. information is with homeopathy, but not you need selenium. Yeah? And I only make jokes, and I told you, I think you remember, in Africa, many people, they die from starving. They have nothing to eat. And then what I had with UNESCO, I had a suggestion to buy 100 MORA devices and the input, wonderful
food.
and at the output, only 10 minutes, and they are no any more hungry. You must give it substance. As a substance.
I remember last time you said that 78 or 4.
Yeah.
Not just the
Yeah.
3. 3.
30.
我不要3而已。 3 or 4. Last time.
Yes.
The amplifier. If they don't too much,
Not too
maybe
much, yeah.
upped it.
Anyway, 100 is too much and 1K is too much. And it even you have more success with 3 or 4 and to do that. But we have no disadvantage when we take 10, and so we take 10.
Okay. Because the super is the small amplifier, we just adjust 3 or 4. When when I use the 78.
Yeah, that is any. And
so now
anything
Nova use the 10.
Yes, and this one.
Adrenal gland. Exhausting or not?
Adrenal gland.
Adrenal gland.
And we go back to the. And here, this machine, I don't know where it is, but we must store here safe.
Safe?
Yes.
Cannot save.
Why not?
Because before yesterday and that one, that is gone. I can try this. Okay, because before I take picture here. And now we finish, right?
Yeah.
And then I go to the menu.
Aber nichts gespeichert. Aufpassen mit der Speicherei.
You see? So, if I want to go to the menu, first, anything of the test set, and then I go back. It's okay. I accept, and then yes. Now I go back, but I go into the Shirley.
Yes, Shirley. Yes.
Und dann?
Yes.
Yes.
Jetzt speichert er es auch.
Yeah.
But I want call up again. Last this time, yes, and go to the main menu. But all of the
Komponente für die Bezeichnung? Cornelissen existiert
I don't know.
bereits.
这个照起来哈。
Komponente. Das heißt, man kommt nicht hier, du musst immer speichern, sonst.
Yes.
你看前点那个都进不去了。
Hier ist, wir müssen erstmal hier.
Ja.
Shirley.
Warte, da ist noch nicht da.
Yeah, no, this is
Das ist schon drin. Dann
Ja.
Test. Der hat es jetzt zweimal drin, ne?
because we second time tell the Nova yes, so yes, but we don't know why.
Ich würde jetzt
Now
gar
it's
nicht
gone.
worauf drücken. Einfach jetzt mal gleich mal ins Menü und dann Cornelissen machen.
Ja, wir müssen ja anzeigen, welches.
Ja, das Problem hat er ja.
Ne? Trotzdem. Nochmal,
Okay.
ne? Und Also ja, hatten wir.
Hatten wir ja schon. Jetzt
und-
Menü.
Ja. Da ist Shirley.
Ja, Shirley ist da, aber wir wollten ja bei Cornelissen rein. So.
Nee, warum bei
But now it's
Sie will
come.
jetzt wieder rein. Und
Ja.
das kann sie nicht. Das geht nicht.
Can
Um
not
nochmal
go
zu
in.
gucken, ob es wirklich auch gespeichert hat.
We can go inside here.
Ja.
And
Ach, dann geht sie darüber rein und dann geht sie.
Nee, das ist, ja.
Das kann doch nicht sein.
but now it's not
Yeah.
in your set. The other new one test
Ja, ja.
with the substance. This
Ja, aber wo sind denn ihre Daten?
I must look when I. Ja, ja.
Gone.
I see. Gone. I don't know. And now, yes, we wanted to test the hydrocortisol.
I told yeah.
We go.
Okay. The other person.
Wir haben jetzt zu viel aufgemacht. Irgendwie. Sie ist ja hier schon
If,
drin.
if we change the Thomas law
Mhm.
and load
Mhm.
and
Menü.
menu.
Macht das nicht mehr
So
klar.
maybe we need a shutdown and
Ja,
open.
ja.
Perhaps
Mhm.
because
Perhaps. Yes, we do it.
yes.
Kann ich jetzt mal runterfahren dann? Oder was? Ja.
这是我们的经验
Gott.
，always shut down and open. Good.
Aber Frage ist jetzt, ob die Daten jetzt drin sind. Von Shirley. Doch, die hat er wohl gespeichert, ne?
所以我昨天晚上一直不敢关，就是这样。上次那个是被我们关掉，它是全部都是乱码，但是你可以打开，它是乱码。
Ist es nochmal angeschaltet, der Computer, der Laptop?
那两个都是乱码。
Ja, kann ich kann das ist
Bitte?
Allergie,
哎，
Vito
等一下再
oder?
打开，说不定就是乱码了。
Ja.
因为之前我昨天晚上只是给它搬到哈尼空，今天又搬回去，然后弄一弄还可以在。
Mitochondriopathie ist gleich offen. Soll ich mal hier den Jungen mal wieder anschmeißen hier?
Mhm.
How I go back and teach my client how.
Yeah, I don't know. And Mr. Hummel will come here to Warnemünde to Rostock. And then I have a list there with all the questions, and it must be easier to understand that everybody may understand it.
Shirley. Huh? This one.
Und jetzt?
And then. Wait.
Da haben sie schon wieder verschluckt das erste Mal. So, jetzt.
Aha.
Hat sie aufgehangen, ne? Okay, und jetzt bin ich hier gespannt.
Yes. Continue. Open. 但是它的 end of test。
Ja.
Yes.
Yes.
Super.
再看看。
Oh, hat er sogar die Mangel auf Rot eingespeichert. Das ist ja nur
Machen Sie
schön.
mal hier, open the turn.
Now in
It's
the two honeycomb. No, China 2. Now in the China 2 because with therapy 78 star. You see that
Yeah.
in
No.
oh no.
No.
来，再把它关掉，它太多了。Back.
Here, but it's like this kind of stuff. So you have to close it.
那78呢？
还是在 6 啊？ 那是
我要打开这个。
没有，那这个。
呀，那我如果现在进去呢？Therapy 这78呢？
So, das ist 78.
Mhm.
Ja, dann
Ja.
Yeah,
No,
it's
it's
okay. Yes, that you must, every time you must go back and open again.
Mhm.
Mhm.
So, if like this, again, you must be go to here, and anyone, and accept, and you can go back.
Mhm. Mhm.
And then, as I say,
See?
this time, no safe. This time the Shirley data is okay, but yesterday or this one, you see, that is not okay.
Yes.
And then,
Mal gucken, ob er die Daten hat. Hoffentlich. Ich meine, ich habe mir was notiert. aber-
Er hat, ja.
and this, you see, this is not okay.
Again, back to the beginning and then.
No, this is not okay.
Yeah, that's not okay. But Hummel told me you must go, you must shut the entire program.
We shut
No,
down
we shut
somebody's
down
time.
many times.
Yeah.
You see the
And always is.
that like this, okay, and the same
Egal, irgendwo
the
raus,
same
dass man
procedure.
rauskommt.
Mhm.
the same procedure, and go
Nein.
9 and up and go again. Yes, this one. Yes, and go to in this. Yes, end of this.
Ja, the same. Schreiben Sie nochmal auf.
Wird nicht gespeichert.
Schreiben Sie auch nochmal auf. Ne?
Diese ganzen
Alles nur
Speichereien.
Substanz.
This is a
Alles
problem.
Mögliche.
Ja, das ist das Problem. Ja. Einfach.
You can show the hormone, this case, and Shirley you,
Ja, ja.
and how to back, and usually back,
Irgendwo
and this is come out. But
Das kommt man nicht raus.
that day, Emily and me found out, oh, we go to here and choose anyone and accept and can go back.
Ja, super.
We find out the root.
Oh.
Das geht ja gar nicht.
So we need a long stay in after surgery, D10 here.
And then we test here. Haben Sie es gerade da? Tumor so und so. Könntest du es mal kurz rausholen? Da vorne ist das drin.
2-1-Therapie ist das.
2, 1, 2. And then we test. You can generally it is sufficient when you test with MIBE. Here are the medication to avoid the relapse. And there are many here in the testing. And that's the first way that you put in the honeycomb carcinomum or mastopathia or like that. Then you have instead of MIBE, then you have a specific remedy against the breast problem. And therefore we prefer not the MIBE but here colon cancer. We look for medication which fights against colon cancer. And therefore that's more specific, you understand. And then when it is possible, after, here you see 8 or 10. And after 6 weeks he should come again, and then again we test here. 60 or T30, and then you, as I told you yesterday, congratulations, you are out of the immediate danger to get, and then after 6 months you should come again. But here, keep attention, when it goes back to D6, then cancer may re-enter, and therefore you must test again. And all the other ones, like selenium and so on and so on, curcumin, and so on and so on. And then that is the question, Emily, why is there a cancer, or you can expect a cancer when there is an amplification of 6, 7, 8,000. Why? Every time you must find an explanation what you do for his 0.1 amplification. You must find an explication. And therefore, D4, but what does it mean? D4 means 1 to 10,000, 4 zeros. And then an amplification 10,000, then you multiplication 1 to 10,000 times 10,000, that is 1. And 1, it is the native tumor. But we are precautions, we are precautions. And then we don't say 10,000 is a native tumor, but we go down and we say, oh, 7,000, 6,000, 7,000, 8,000, there may be a tumor, there may be present a tumor. That is the argument why the amplification 7,000. But here again, never amplify this one. Only carcinomum, D4, quantified tumor can be present. Is there any question for that? And therefore, it is always recommendable to combine the benign tumors and the malignant tumors. And you have both, but when you quantify, and then the malignant tumor, they will disappear, and then you have with you here only the good ones, they will be testable. Is there any questions to that? No. And you see, it is a word to chemotherapy. You see, with chemotherapy you may eliminate 90%, but when there is and 1 billion will rest, and 100 million tumor cell left, and so on and so on. And every patient we tell, 80% of tumor patients, they don't die of the tumor, they will die of the metastasis. And we can, with MORA, we can avoid the metastasis. That is on the big advantage. And here, look, rate of elimination, 99.99%, 100,000 will survive. And therefore, chemotherapy, sometimes it is necessary, sometimes not, but you must add supplements or to support the body's immune system. That there is only 20% of the primary tumor they will here. Only chemotherapy, only you have to 80-90% you have a success only with leukemia and tumors of the blood. Only tumors and breast cancer and so on. Ovarian, it is very rare that you have with ovarian cancer there's chemotherapy and so on. And here, yeah, and here, when you will determine whether there is a generally a good situation in the entire body, then you can test the DNA. And when you test resonance, DNA D6, it is very good. And when you test DNA 200, there's nothing.
Nothing.
200, potency D200, nothing. And then you must do, perhaps for years, you must do something, selenium, zinc, and so on and so on. And then, here, the better, here, acidum lacticum, that is milk acid. Acidum lacticum, yeah.
Milk acid.
Milk acid. And when there is a high burden of milk acid, D2, then a tumor can be present. And when you have acidum lacticum LM16, very, very small, because every cancer produces a lot of left-turning milk acid. Lot of. And so you have really a lot of tools to fight against, here in Germany, breast cancer, every year 46,000 will die. Will die. And that mainly by estrogen dominance. Therefore, keep attention. Prostate, environment, and intestine, auto-intoxication. Auto is decay, is too. And here, urine bladder, environmental toxin, womb, estrogen dominance, and so on and so on. And then here, breast cancer, early detection, you can, they can heal about 80% and late only 20%. So we can test the tendency, and the zinc, your vitamin, and so on, and so on. Here, and then it is, it is terrible. They starve from, or they die from starvation. They will not eat, because it is really so hurting. Here, that is candida, too. All mucositis, it is burning. Pains. Patient die of starvation, and yes. Yes, but that is difficult. But here, acidum lacticum, and when it is high, keep attention, a tumor may be present. AMS, once more, right turning, can neutralize the left turning. The tumor is only, in the tumor, is only left turning. And you can neutralize this by right turning. And you take every day 30 drops, and that is the best for the intestines and so on. And he must stop when there is a patient with cancer. At once fruits, at once mustard. Here, glutamine. Yes, you remember Emily too, that's the environmental toxin. They have a hormone effect, and it is in 90% they have estrogen effect.
That's true.
Whether there is formaldehyde or there is PAC or there is PCB and so on, always estrogen. And you have in your body estrogen, and when there is a lack of progesterone, even higher, and you must mention it. You cannot, doctor, you cannot determine the environmental toxins. We can it without any problem. Estrogens high, always cancer high. Hormonal character, yes. And see, cancer, the race against that, more than 40% of all cancers affect the productive organs. 60 up to 80% are avoidable by use of money. Imagine, 60 up to 80% you can avoid here. Then more than 40%. And estrogen, again and again, it is really bad. Estrogen is an endogenous carcinogen. The message, grow. And progesterone is an anti-carcinogen. And here you know.
Die übergewichtigen Frauen, die dann eher dann auch förderlich für welche Krebsarten oder auch jetzt Ovarien oder Brust oder so, ne?
Yeah, and yes, that is very interesting, but yeah, female feminization, and in the States they fear that in 2030, 50% of men in the USA will be infertile. 50%. Whether it is correct or not, I don't know exactly, but it is a really problem. Feminization because of the exposition of estrogens. Ja.
Das ist ja unglaublich.
Ja, gibt es jetzt wieder neue, die soll noch größer werden, dadurch, weil das Übergewicht auch wieder dabei zutritt, nämlich
auch noch förderlich ist und beides zusammenkommt.
Und das war da noch niemals einbezogen. Ja, and here again, cancer, estrogen, progesterone, apoptosis, and that means the cancer cell will die by apoptosis. And yes, you know. And, ach so, das wollten wir ja noch. Hier.
Die Einnahme von dem Progesteron?
Ja.
Ja.
We will give you, or do you know how to take progesterone? Yeah.
Das. Ja, aber wie?
We give you, is a monthly cycle present or not? You have the month?
No.
No. Then nach der.
Die englische Einnahme.
Nee, ich meine die nach der Menopause.
Ach so, nach der Menopause.
Also 3 Wochen nehmen. And then here, yes, we will go upstairs. And next question, what time we have? We have a little break, and then when you have any other question. Bei dem, das sind eine Regel bei. Und wir haben oben das neueste Zeolit.
Ja, weiß ich nicht, Base mit Zeolit, also beides, Basenpulver und Zeolit, ne?
Nee, das ist noch was anderes. Das ist jetzt wieder ein Basenpulver und Zeolit. Nein, das Konzentrierte. Das heißt Detoxan. Haben wir oben.
Aber das kann dann auch nur das Aktuelle rauslösen, nicht was jetzt aus dem Bindegewebe raus soll, was da gespeichert ist. Darum geht es ja, ne? Ja,
aber das ist ganz einfach. Das kann gar nicht die Mucosa passieren. Das geht gar nicht im Körper und das ist auch gut so, aber eben nur für den Zweck nicht. Ne?
Nee. Sie schreiben es halt so hin und man interpretiert dann den Rest rein. Sie lassen es so ein bisschen offen, ne? Wenn da steht, oh, wird gebunden, das kann für mich heißen, okay, bringt es auch raus, ne? Aber
ja, sicher, ich sag ja. Das ist immer so, wenn man einfach das.
So die halbe Wahrheit, ne?
Aber die Frage ist, wie passiert Zeolite die Darmmucosa, ne? Darmschleimhaut. And is it possible to prescribe hormones in Taiwan?
Doctor.
Yeah, doctor, but you,
Yeah.
for you it is not possible.
No
Mhm.
husband.
Mhm.
Haben die denn so viel Alzheimer da? Weil die immer noch
But when
Die
I
nehmen da alle so ein Zeug da. Die grünen
but then when
Dinger.
I test with patients,
Mhm.
their deficiency of progesterone, I ask
Ah, yeah, yeah.
clinical doctor
Mhm.
prescribe
Uh-huh.
for.
Yeah. We do this too. Ne? When there is a natural partner and we give the
Was
prescription.
apothekenpflichtig ist, ne? Oder warum?
Ja, ne, ärztlich. Ärzte dürfen
Bei
auch.
denen auch so, ne?
Mhm. Genauso. And because as in sport, and not work. You see here 20, 30, 40, and here's 50. 50 years old. And then here, when we prescribe melatonin or DHEA, we will not doping. But here, this curve, which goes like that, we will only like that. And that is not poisoning the patient, that's not doping the patient. And here, you see, and what is my argument? Oh, you are against hormones? Prescription of hormones? Oh, yes. Oh, excuse me, I'm a dentist, and I see there is not a right tooth. You must
Remove.
eliminate your tooth. And oh, you are wearing spectacles. Oh, don't do that. It is not natural. Then put off the tooth. It is not natural to have artificial teeth and so on. Crazy. But when you take hormone DHEA, that is doping. Nonsense. And here, for example, when you have diabetes too, nobody will reject insulin. Nobody. Yeah, but it is a hormone too. When there's something wrong with the thyroid, he will take every morning the thyroid hormone, thyroxine. And then he should not take the hormone too, thyroxine. Then he must reject thyroxine. That is, and so I will correct here this curve, not that it's like that, no, that it's like that. And yes, that is, wo habe ich mal?
Und wenn jetzt hier die Östrogene in der zweiten Lebenshälfte ja auch abfallen, damit ist das gemeint, dass es aus der Balance ist, dass sie zu
Ja, das ist ja physiologisch, wir sollen ja nicht ganze Leben lang Kinder kriegen.
ja, genau. Ne?
Das ist hier,
das ist ja
these
jetzt-
are the estrogens. There is estrogen, we are happy that the estrogens go down, because it is an endogenous carcinogen.
Carcinogen.
Endogenous in our body. And therefore, yes, is it a mistake of our holy God? Because estrogen forms the cancer. No. At the beginning, and more than 100,000 to 500,000 years, the young women, they started to be pregnant with 14, 15, 16 years. And then with 40 years, then at that time they died. And during that time they got about 8 up to 10 children. That means there was almost every time pregnancy. And what is during the pregnancy, when they are pregnant? No estrogen. During the pregnancy, the body will not produce estrogens. estrogen. And therefore, and when they, at that time, 2 years, 3 years, 4 years, they nourish the baby with their milk. And during that lactation time, and no estrogen. So that in former times, the women, they were nearly always estrogen free. And therefore they couldn't develop cancer tumors. Now you understand. That is only because we have no children. And you see, nuns in close nuns, holy women. You know nun? What it is, nun?
Yeah.
God. Serve
women
for God.
in
Serve the God.
in the church.
Yeah.
Oh yeah, you
Serve
know,
for
the
God.
church, the nuns, and they are not married, and so, and they don't get children, you know, and they have a 6 times higher risk to get a cancer. 6 to 8 times a higher risk for cancer, because they have so many estrogens during their life. And when you have 8 up to 10 children, you have never a high level of estrogens. You understand? That we can explain it, and he must, here Dr. Lin must explain it. Then I will listen to him, and then I will change my, when I see, oh, it's a better argument, but we must have an argument. Why is the breast cancer so widespread in all industrialized countries? In all industrialized. Yes. Other question? No question. No question anymore. No, you are happy.
Again, tell us please test the allergy, the IgE,
Ja.
the procedure.
Mit dem Vortest meint sie?
Bitte?
Mit dem Vortest meint sie das jetzt?
Ja.
Das Testen? So. Habe ich hier alles.
If our customer use the super, use the pre-test, the IgE, and his time, that's the procedure.
Yes.
Not the Nova.
Not the Nova.
Yeah.
Yes. Where a patient with a super, and if you ask him, why do you come to visit me? You ask the first question. And or the first question you say, have you enough money for me?
Yes.
Yes, we have. And then
Allergy.
allergy. Yes, and then we ask, what is your main problem?
Maybe the nose, getting wake up in the morning and
Yeah. Yes, I asked him at first, now, are there any allergies present? Do you suffer from? You suffer from. Or most patients who come to me, I have a problem with my bowel.
Yeah.
Oh, there is a chaos in. And then here, nose, and like that. And then I always start with the pre-test. The pre-test. Then before doing anything. And then, and here, I propose or suggested to Hummel here to start with the pre-test too. And now they didn't want it, and so it is below allergy. And therefore we will test something. Who will be tested?
Allergievortest?
Yeah, or this one or this one here.
this one.
This one, yes. And now we need one victim.
White victim. Yeah.
Yeah,
Okay.
yeah.
Okay. 来做。
Kann ich auch testen. Ich
做
habe ja wirklich.
说之前他
Ach so, ja, jetzt hat es
你们上次应该有讲这个，但是我们的客户都还是搞不清楚，我要把它弄清楚。
We don't have, we don't find at the moment. I have connecting.
Yeah, yeah.
And we do it with this one. Ne? We do it with this one.
Yeah.
And we have there, but I don't find it at the moment. And we can take this ne, here for the Nova 2. We can take. But nevertheless, and then we do it, ne, you know, like that, like that, like that. But now we do it step by step.
Okay, step by step。
Okay.
你就帮我录哦。
What?
他应该先测啊，那按距离先。
Nothing, nothing
Nothing.
at the moment.
It's close. No.
Ah, yes. Ne, clever. Yeah. Yes. Oder wenn es nicht unter den anderen. Mime. Ach so.
Hab ich da doch nicht drin gehabt.
Das ist ja so gemeint. Ja, guck mal.
Ach, ohne? Ohne die Schachtel?
Ja, kann man auch
Ist
so.
das besser?
Very good. And now we start always with IgE.
IgE.
That once more.
That IgE and how
100.
many? 100.
100 and
Substanz ist
ne,
Mitbilde.
ne, das ist ja jetzt ja. No, no, it is not correct now.
Now it's 1,000. 1,000.
Go on 8.
8,000.
7. 700. No,
7,000.
7,000. It is very, very high.
Yeah.
High. And keep in mind, IgE means that's only information. Allergies, that's not a substantial burden. It is only information. And therefore, you can treat it very well with MORA, because MORA is information therapy, and this is information too, IgE, not substantial. When it is nickel, you must not have nickel in your body, but it is only an information in your body. There's a program which reacts on nickel. And when you give him for nickel DMSA, you will not have any success. Yeah, you understand? Yeah? And then that is only information, and that is like to put the bottom when you have nickel on your jeans, and then with the jeans, program is switched on, and then all the red spots will appear, and that's it. No substance, and 77 at once. And we go on with the next one.
Histamin?
Histamine.
No?
Yeah. Yes.
100?
Yeah. You start his IgE, histamine, with 100, but normally you can go higher, 500 or even more. Nimm's noch mal runter. Ja, ist noch nicht gut.
Der Punkt ist nicht gut zu messen.
Once more. And again. Hoppla. Ja. Histamin.
Histamin.
Ja.
More? No.
3,
No. 1K.
1K.
Mhm. Seven, and here is
1K.
no less 700.
700.
No less. And histamine 300. That is not
300.
much. Then you must have more than 1K. So you can forget. You can forget your stomach, your bowels. You can forget. It's not her problem. And for me, normally must be more than 1K. IgE 7,000 or like that, and here only 300. And now you have the
Must
allergy. Always the two. Yes.
25. And with
No. That's the same as IgE. That doesn't matter here. The two ampules. No, you can start with 100 or even 500.
no.
And less? Weniger? 4? 3? Nur mal entfernen. No, nothing. No mosquito allergy. And
IgA.
IgA. That's only when there's something with, wrong with the bowel. But there's no histamine, and so we will not. You can stop here.
Also man müsste das jetzt nicht messen.
Yeah, nothing. Yeah, and
Nur wegen der Vollständigkeit.
only to show you, to demonstrate it.
Hühnereiweiß?
Yes, that is yolk of
Yolk from egg.
from egg, and that's only when there is a mosquito allergy. Mosquito allergy.
Also
Away,
dürfte das
nothing.
weg, ne? Eigelb dann auch, ne?
I can not.
Dausin wäre Histamin, ne?
Dowsing is only when there is histamine.
Ja. Und Zitronensäure aber.
And citric acid, that is only when there is leaky gut.
Leaky gut.
No? Leaky gut. Hoppla. That's the point, it's not so. That's better. But there's no leaky gut. Yes, and the only result was IgE.
IgE.
The genuine, we call it genuine allergy.
Gene allergy.
Genuine
With the MORA
allergy.
syrup.
Yeah, and what do we do now?
Man startet dann noch. Also vom Prinzip kommt sie als Patientin und sagt, sie hat irgendwie eine Allergie.
Ja, hier.
Dann haben wir es festgestellt und jetzt müsste man trotzdem den normalen Test durchgehen.
Nee,
oder?
eben, wir machen direkt a special test.
Ach
And
so.
the special test, we go to the great allergy.
Die große Allergie.
No?
Testet.
Yes, that's it.
Ach, da kommt man da halt schneller.
And now, no, we will put here the IgE. Here, IgE. And then, ja, vielleicht ist bequemer für Sie. Ne?
Ich habe Angst, dass die Dinger runterfallen würden, weil es geht auch so ein bisschen abschüssig immer so.
Yeah. And then here it is a correlation between IgE and here the allergens. No? And therefore correlate. No? You understand? No? Only when we carry out the correlation. And now you can find not general burdens, not general burden, but especially the allergy problems. Only here the allergy problem. Yes, but first one,
Major allergy.
Mhm. What do you think?
Yes.
Nehmen Sie noch mal raus. Yes, but we don't know, is it a burn intoxication or what? And therefore, we want only find now the genuine allergies. We put in IgE.
IgE.
Yes. Ne? And
Open.
ne? Amalgam can never in egg yolk we tested, no? And egg white gluten know that it's never a genuine allergen, that is an intolerance or like that. And yeast, the yeast is a hint to candida. When it is positive, histamine. Now we can do it once more.
No.
No, latex it can be.
Yes.
Yes. Huh?
Relation like that.
No, it is not necessarily masked allergies. You must test rye and wheat and so on. But here it is never, no? And then here wheat, no. Lucky stride. No, it's nonsense. No? How many cigarettes do you?
Guluas. Stärksten.
Sugar, it is really nonsense too. Nonsense, but we can do it. Nobody can have an allergy to sugar, no? And milk products, there's no genuine allergies. No? Cereals, no. Fruits.
Fish.
Yeah. Yesterday you ate yesterday evening. That was no lobster.
Whole fish.
Cod, ne? Crab. I think yes.
Oh no.
你加拿大吃太多螃蟹了。
Yes. Oh. Seafood. Oh my god.
Tuna.
Oh no.
Yes.
No.
Also Meeresfrüchte allgemein.
Yes, you see, seafood is
The major
completely forbidden. But you can eat every fish. We say you can eat all fish
With
which
a
have
spine.
with a spine.
Yes.
With a spine. And so, I think is it clear now how to do? That is not she can have a great burden, high burden of amalgam, for example, but it is not an allergy. And so we started for the elimination or neutralization of the seafood. of the seafood. And what was the end test?
Kann die Ampulle wieder raus, ne?
Nothing more? Yeah. And
Jetzt in die Waage.
yeah, you see, ne?
Quantification.
Quantification. Yes. Wonderful.
Quantifizieren jetzt, ne?
Quantification, yes. And 1 K, 1 Kilo Ohm, Kilo Ohm, sag ich schon.
We need to put here? Okay.
Yeah. 10 K. 100 K. No, even more, I can. Aha. Back. One back, only this here. Yeah. 100.
100K.
And this time I would like, but can we, here, is it correct that we can connect the back electrode here? Yes, we have the cable.
Yes.
And I would like to perform here the neutralization because I want to test afterward whether the machine
Okay.
works.
Okay. 来吧。
The other one? Ja, der hängt.
Hier.
Da ist er.
Yeah.
Okay.
And it is correct.
Yes. Right.
Red.
Star therapy. And 10. Back. 10.
Yes.
Stars therapy.
And
77.
yes. Output is red. Yeah. Doesn't
back.
matter.
Close.
Go back.
Yeah. And now?
Now therapy.
Yeah.
Star.
那是七吧。
Yeah. And red is out.
Yeah, red is out. And this with this. Yes.
Again.
Pardon?
Stop.
It out, yeah.
Now it's
I was 99.
99. Now it's 77.
Mal gucken, ob er jetzt in
Ey,
der
这么快就可以
Phase nur
做就
60
可以看到
Sekunden macht, ne?
他说的。
Ja, das haben wir verbessert.
Ja?
对啊，就是他每次就做完直接测。
就这是，
可是因为把你信号马上就给抵消
他
掉。
说这是虚嘛。
So if I do the therapy, I can
Yeah. At once. Ne?
At
Here.
once, at once go to the
Yeah.
river side.
Ja, das kann man wenigstens löschen, ne? Das ist
Ja,
positiv,
ob
ne?
der jetzt richtig gut an. In this case, it was not the best way, but I will only see. Ne? But you cannot mix latex and seafood.
Okay.
Then, ne?
trennen, ja.
Must be one group, ne? But I know that. But other people, they always mixed.
Yeah, mix
two
together. 所以这也是我们的错误，每次查一大堆，通通放在一
But
起。
better is both, and to quantify this together and this single. Jetzt geht auf IgA, SIgA, and you have dowsing, you have a deficiency. This time it is better.
So I recover myself.
Better.
My body recover itself.
所以它是有 histamine 的，
然后就可以这样去查，就是肠道的问题。
histamine 都是肠道的问题。
对，就可以去查。这个批数fertig.
啊，他说 I have
还有 massive allergy，
然后 IGI 就只是就可以直接排。
阿玛斯卡勒他说是主要是像是小麦那些，
zweite Phase，
小麦牛
10, 90.
就所以他刚刚是用那个 IG 放在这里，然后跟他
90
那些过敏源做一个
nee, 90
correlation。
Puls.
对，
就是如果是
那如果是 histamine 呢？
因为上面的话就要去治肠道，然后看看它那个有没有很低，它有很低的
Ja, 90 Sekunden da unten ist das. Hier unter, ja.
但是要不要用 histamine 跟那些做
不
correlation？
用，因为它就只是它会 quantify 你的多高，你就查太高什么，就直接
Nee, das habe
它
ich
会
dann
吃
auch
药
gefragt.，
就是那些。
Die 90 Sekunden reichen aus und gehen jetzt zu 1,5 Minuten bei dem Alten pro Phase.
Andur
Das ist
Maske,
meine
Ich
Frage.
sehe den großen Unterschied.
那是 allergy，他就说
zwischen 1,5 Minuten und 90 Sekunden.
胃过了，胃的话就比较
Bescheuert.
牛奶的话，
Ja, genau.
吃牛奶。
就是牛奶呀，
Fundamentaler Unterschied.
Ja.
但是我
Nee, aber wenn man so
记得以
konzentriert
前
ist,
master
passiert mir ja auch.
会
immer
两
wieder,
管
ne?
放着，
Da
然
man
后
ist
还有
so
用
schnell,
20
ne?
倍
Und
做
dann,
还有另
correlation，
外2罐，它不是
哎，两罐，然后做 correlation。
它也有放。
If the patient has a muscle allergy
Mhm.
and use the 2 ample here and the correlation
Mhm.
with 25 with
Yes, always when there is a pull in the input,
Uh-huh.
always correlation, whether it is IgE, whether it's mosquito allergy, and so on and so on. Yeah? Always correlation. When you have 2 different substances and you will compare them, then always correlation. Therefore, I marked it with green that everybody can see that.
所以它的 preset 就是它把它分成，如果是 IgE 的，就是一般的基因 allergy， 然后如果是 histamine 的，就是跟肠道相关的 allergy。
对，就看 histamine， 然后再看那个
histamine，
还有另外一个就是看 mast allergy，
对，那是
然后就一起去。
Es wäre wahrscheinlich auch einfacher, wenn man was können wirklich nur echte Allergien sein und was können nur Intoleranz
Ja,
sein.
das ist ja, entweder damit kann es nur eine Intoxikation sein mit Amalgam oder Dioxin.
Ja, aber das muss derjenige dann wissen, der es macht.
Mhm.
Sonst könnte, wenn
Yes, but here we had a histamine, a certain histamine burden we had with, we tested, no? 500 or 600? Why?
你看 histamine 有多高？
war Histamin aber wenig bei ihr, ne?
Yeah, then it was not dangerous. It's not dangerous, but we must see always the connection. Why we tested histamine positive, not in a high amount, but we tested it positive.
Because the seafood
Yes,
usually
yes.
histamine.
Seafood has the highest amount of histamine. She didn't eat it yesterday or so, and that doesn't matter, but there's a problem in her. No? And so, no?
So now it's done. Need more time?
No.
No, just one
Only
time.
to see whether it works.
Thank you.
你已经把它温热了，要拿起来。
Moment, das ist. Ah, ja.
You write him or that you found him, then it's during this week, no.
No. Because I have no internet. But he will come on the February 6th. He need February 6th and 7th,
2 nights.
tonight. He wants you.
Yes.
That's for him, not for you, right?
Again.
换手，赶快自己手换过去。 还是你脚的踩着会好一点。对，有时候多一点那个接触力。
And how old they are? The two daughters.
Children,
差不多
two
20岁左右了。
20 years old.
Oh, nice. Yes, and yes,
但是他现在在
it's
这里
okay.
面，
没有
在那边这样。
Yes, it's okay. It's okay. But here, 10K.
10K.
More.
那刚刚是多少
more. 5.
7K.
Less. Less.
70.000 runter.
From 70,000 to 30,000. 70 to 30,000. No? More than that. But that may it may depend on latex and seafood because yes, and we should yes, we will test here with 1K. Aha.
这个还不行。
Das ist muss es lecken.
No. Yes, only
crab
and now we look for here latex. No? Only this one. And not no.
Take out.
Take out the honeycomb.
No, more. 10. Yeah, 10K or like this.
Okay.
More. Less. Less. 10. Okay. Yes, it depends. And but I think she will recover from here the seafood only by 2 other treatments, and then I think yes, no great problem. But latex, I would control and check in 2 months, 3 months, and then in the autumn again.
Wenn man das getrennt hätte jetzt und dann wäre das Ergebnis besser gewesen,
Wäre besser
wären wir weiter runter gewesen dann, ne?
Ja.
Bei beiden jeweils.
Bei beiden jeweils. Und wie gesagt, es ist immer besser, eben ähnliche Gruppen, die haben ja gar nichts miteinander zu tun. Eines ist ein Lebewesen, das andere ist ein Gummi. Ne?
Ja, muss man ja auch wissen,
Ja,
welche
ja.
Gruppen man zusammen machen kann.
Ja, aber das ist auch eine Frage davon. Ne? You know that you will separate and then both would be lower. Both would be latex and the seafood too. But it is not a high. We have often we have 1 million and so on. It is not. Yes. When and I'm sure. And now I don't see.
对呀，没有啊。我们也会找问题。
Das heißt, man kann das Frequenzband nicht sehen?
Ich
sozusagen?
teile
Nee,
das
man kann,
Urteil.
das ist eine
全部都是
Absenkung
问
von
你怎么
den
用。
Verstärkung. Das fängt mit 64. We start with 64, and that means that is the highest chakra. And then we go down to 16, and then we go up to 32, and then we go up to down to 8. And
你有没有看到这个3这里22？
yeah.
但是这个哈、现在是23，但是这个是被我改过的，你们有没有发现？
Amalgam, will you
因为
hear
这个现在是4，现在
amalgam?
是正常的，这是我改的另外一个。
Here, amalgam. I'm curious. Huh? That is,
Amalgam
yes, to detoxify. And
stop. Stop. Continue. 这个 amalgam 这里手这里全部都是没有的。But this amalgam, no hand, no,
electro is not
no.
just
stylus and
just with the roller.
Macht nur
Ja.
Rückenelektro, heißt das.
Or the other special electro.
Das ist nur Rückenelektro.
That's only here. No? To some, and you see the frequency. Yes, the frequency of amalgam is between 7.6 and 13.5, and here is 2000.
2005.
It is not sufficient. Not sufficient. And you can here check. You can do it at home to determine the frequency band. You can do it. Try it, and you will see we'll have the same. Now, when we would be here upstairs, only in some minutes, I can prove that. But why 2,500? Why?
I don't.
Why not 3,000? That's only the low pass. No? There's no high pass. The next one.
它这里，但是它是不同的 channel 啊。Different channel, channel A and channel B, but now just channel B. 第二个步骤。
This one has no.
But the second
Why?
stage, why A bar? This is amalgam. Why A bar and the channel B?
B, A.
A. I don't know.
That is A is a dry injection with amalgam.
Yeah.
Therefore, that's old. Also must give me an explanation for that. No? A. That's A. Only two.
The amalgam detoxification.
Yeah. Nah, we will not lose our time.
Yeah.
Yeah.
And
Cancel.
that is a new one. That is a new one. That's the same as Utroges, but this is really the same company and so on and so on.
Okay.
But they sent it to Netherlands, and Netherlands they brought it back here, and then it is not so expensive. It's the same here, Dr. Kade. It is a company in Berlin.
Berlin. Okay.
And all medications are very expensive in Germany. So the same companies send them to Netherlands, they send them back, and now they are less
Cheaper than
yeah,
before.
cheaper.
No. This
is very good.
Very expensively.
Das will sie für ihre Mutti mitnehmen wegen Diabetes, ne?
How much is it? Do I have you?
好像80块钱。
No, 62 or 61.
Halt das mal der Jan durch.
Yeah, but you can read it, ne? And please keep it in mind. Ne? Starter is always cholesterol. For all hormones. Pregnenolone is for the memory, and DHEA, you know that? And therefore, yes, when you have DHEA, then the body can transfer it to all the estrogens, to testosterone, to estradiol, and so on. And DHEOO, da fehlt ein Fall. It is better that you learn it by memory. Ne? It is better. And therefore, be cautious to take cholesterol blocker. They are called statin. And the statin, they have a lot of side effects. And note well, a low level of cholesterol can induce cancer. And so many people in Germany, they take regularly the cholesterol inhibitors. Really. And you see DHEA and progesterone. And yes, because the level of cholesterol is sometimes high and sometimes low. But when the level low is, and you take a cholesterol blocker, then the level will be too low and cancer can then emerge. No? That is a problem.
So inside we check the cholesterol. It's
no.
On the metabolism inside.
We tested cholesterol, but it is we tested cortisol.
Cortisol.
That we tested, but not cholesterol. There was no positive result. You think we tested cholesterol here with you or with whom?
No.
No, we didn't do that. But cortisol. That was,
Yeah.
and
cholesterol.
Here risk for mama cancer red increased. Here estrogen increased, estradiol increased cancer risk. And now, that is interesting too. In Taiwan, you have a high level of environmental toxins. So, and you are burdened by it. And then what does the body do? The body produces more and more cholesterol because cholesterol can detoxify the environmental toxins. You understand? And therefore, and you go to the doctor, oh, Thomas, high level of cholesterol, you must take here the statins. And the statins, they are very expensive. And then you take the cholesterol, the statins, and now the cholesterol goes down, and then it cannot be, the environmental toxin cannot be detoxified. You need a higher level of cholesterol. Otherwise, the body cannot detoxify.
Yes.
It's crazy.
Yes, there's a very mean sensitivity.
Yes, we say below 240, we don't give anything. And when we give the red rice, red rice, we have a medication which consists of red rice, and that is sufficient, and there's no harm. But you can produce cancer by decreasing too much the cholesterol level, especially with you. Here, read it once more. Cholesterol detoxifies environmental toxins, and cancer will go down. And you see the environmental toxins, they have an estrogen effect, and estrogen may increase the cancer. Und so hängt alles zusammen. Und wenn man noch so jung ist wie Sie und alles so schön behalten kann.
Da brauche ich meine Alpha-Liponsäure, damit das noch besser klappt.
Nee, das ist einfach viel und verwirrend. Mein Gott, Sie müssen mal dabei sein. Wissen Sie hier, hier Frau Wegener, oder ach, die Frau Steuer. Frau Steuer, ich meine, Frau Wegener, wir unterhalten uns ja auch. Aber Frau Steuer, Herr Doktor, die sind richtige Doktor und so weiter. Die wüssten ja überhaupt nichts.
Nee, da habe ich auch schon festgestellt, ja. Das ist ganz auch grenzwertig, finde ich.
Ja. Here, properties, pH. Everybody, starting with 45, and should
45.
45 should take DHA. DHA protects from heart circulation, high cholesterol, DHA. Here, osteoporosis. Yeah, Alzheimer. You know. Cancer, above all, breast and prostate. Allergy, high blood pressure, autoimmune disorder. Yes, because it's DHA is not a real hormone. It is a basic of a lot of hormones.
But which pharmacy that DHA is good?
Basics.
Here, you can go here. There, yes.
Yeah. Which can I show you?
Yeah.
Hat sie Großeinkaufvariante schon mal? Hat sie Großeinkaufvariante?
Ja. Das ist alles so teuer. Sie kennen ja die DMSA, kosten da without a prescription. Yes, it is forbidden.
Forbidden.
Yes, but you are foreign countries and but it is.
Can I eat this?
Yes, it is very good. That is micronized. It is especially good. This one.
Ja, aber wie viel müssten Sie jetzt nehmen?
Ja, Sie.
还有什么 forbidden
他说他们是自然疗法医生，不可能给，这个是药。
哦，
One a day, ne?
One a day. Okay. Das ist 25.
Ja gut, diese Hochdosierung müsste man ja nur eine Woche nehmen.
So this is straw.
Nee, was nicht, wie nochmal?
Ich sag diese Hochdosierung.
那我应该多买几瓶啊？
Ne, der muss 7
Euro.
Nein, bei Männern und Frauen ist verschieden.
Also er?
Die haben ja auch manchmal andere Schuhgrößen.
这是要开处方签
Nein,
的。
aber weil wir gemessen hatten 60 Milligramm.
Ja, dann nimm 50
所以你就说报他的名字，他就买了。
Auch während des Zyklus und so
我
weiter.
等下再去买个2瓶。
因为它是放在外面的，它日本不就放在外面吗？放在架子上吗？
架子上也要他们可以拿给你，不是你随便。
不是架子上都可以
Ja,
拿。
und das können Sie sich vorstellen, weil an der Arbeit ist die ganzen.
Ja.
Das macht kein Mensch, das macht alle die Firma. Aber die Firma hier, sehen Sie hier, ne? Sehen Sie hier, Zigaretten kommen, werden dann reingebracht. Ne? Yes, Emily, last question or finish? They said it's not. Yes. Here, when there is cancer, and in former times, then the doctor said, you must go to the dentist, and you have a bad tooth in the upper jaw, and you must remove this one. No, never, never, never. And you see, no removal of mercury and amalgam, because mercury in a tooth doesn't do any harm. Doesn't do it. But when you remove this, then the amalgam is spread all over the mouth and then the organism. In tooth, not harmful, but in the body it can be harmful. Never, never. And when a patient is suffering from pains, you can give him an injection with procaine and so on. But best is not to extract the tooth. You have to wait, not in the connection with tumor surgery. You see, amalgam in teeth is only a potential, but in the mesenchyme is a real factor of stress. And every treatment in the teeth and bones of the jaw is to omit. Don't do that. To do nothing is sometimes better than a momentous activism. No, no.
Alles begriffen.
Thank you. Yes. Then I can shut my little computer. Correlation. That means before there's no frequency which corresponds to milk. Until 49.5. Exactly. You can exactly determine it. So, and that is the low frequency start of milk. And then you go to the high pass or high frequencies. And then there's nothing in the lower frequency region. And then you start from 180. And then back. Nothing in the lower part. Nothing. And 170. Nothing. 130. Nothing. Step by step. And then 80. Nothing. That means you can forget all up to 59.5, and now we are 80 with a high frequency. Nothing. You can forget all. And then 70. Nothing. Then 60. Nothing. And so you can forget all these, the low, and the higher ones than 60. But then you go on. And suddenly, with 50.5, 53.5, you have a resonance phenomenon. And that is the higher point of the frequency band. And then you take off only the frequency from 49 to 33.
To 53.5.
And that is the frequency of milk. You can do it with, for example, with amalgam. And with amalgam, it starts with 7.6. It's the low, the beginning of the resonance. And then we start from 180 and we go in little steps, and then with 13.5 there is again a resonance. That means the frequency band is between 7.6 and 13.5. And there, you can prove it. And then, that is the next step. It is, I think, more effective when you only take this small bend that is like a shot in your heart and not boo, and therefore it's the best way to neutralize is to take this specific frequency bend. But it was so much work, only the different substantive frequencies. And so I decided after 2-3 years that the difference was not too high. And so I put together from 7.6 up to 53.5 one frequency band. And then you have included all frequencies of our universe. And so I did it with Poland and so on and so on. And we have specific programs only for Poland. Poland is here from plants, and that is from 22 up to 35 years. And so, but I put them together, and it's much more effective than from 100 to from 0 up to 180. Yeah.
But in the super,
Yes.
that band is from this point and enlarge and end.
Yes.
Because has a star sign on your program.
Yes. That means that's only the amplification. Amplification.
Okay.
That's not the frequency band. The frequency band remains always the same.
Okay, that's
But the amplification,
Okay.
because the amplification, it is absolutely necessary to change the amplification. I did you with red and with green at the wall. When you look, the eyes they get tired, and then they will see the opposite. And therefore,
inside nova has a dysfunction.
Yeah, it was a super too.
No, I mean this nova
Yeah.
has a like dysfunction with the star.
Yeah.
Yes.
But here you see.
We can see.
Give me one
Seven?
program. No. One program of the. Yeah. And now
Which one?
choose one. I don't know. And then
Star?
start. Ah, that is not so. No.
Okay, star.
And then you have here 3.7.
7.
That is nothing. That is nothing. And
But where I can see that like a super the amplification because in a super we see the star. We know that amplification is from small and to the
yes, but
here
nothing.
no.
That is at every program without the star is not an optimal program. It must be look at the wall and choose another program.
Can we shoot 77? Okay, 77 and star. Can see the amplification.
that means here physiological, 呢 But
所以
I'm-
我这看不懂。你知道 super 它有个那个，它只要是